So, okay. Good evening. Hope you are well. A warm welcome to all our participants for tonight. And our webinar is titled Understanding and Responding to Dementia-Related Behaviors. And we are truly excited to have you here as we embark on a crucial exploration of a topic that deeply impacts the lives of both patients and healthcare providers. We will unravel the complexity surrounding dementia-related behaviors, uh, understanding them better, and equip ourselves with effective responses. Whether you're a seasoned professional or someone new to this subject, your presence enriches the collective learning experience. So we encourage you to actively engage with the content, post questions, and share your insights, especially in the chat box. So this webinar is an opportunity to gain knowledge and a platform for meaningful discussion and collaborative learning. So I'm Dr. Mary Joyce Ramrus. I'm the PNA Education Chair, and we have our Zoom Master, Ms. Carol Robles, and to welcome us officially, the Eastern Vice President of PNAA, Dr. Warly Remigio.
Thank you so much, Dr. Ramos. We're so fortunate to have this great partnership with the Alzheimer's Association because as Dr. Mary Joyce had said, it's such a devastating disorders, right? Debilitating disorders. And it's so important for us to truly understand the predisposing factors and also how we can best care our patients, our relatives, our friends who are in the communities suffering Alzheimer's and other dementia. And I'd like to take this opportunity to thank our distinguished speakers, which will be introduced shortly. We're very grateful for sharing your expertise, your time, and we're truly inspired by your passion on this cause. And we want to thank all of the participants for gracing their time with us tonight. I know that a lot of you are either coming from work, right? So we really appreciate you for taking the time to be with us. And so on behalf of the Circle of Presidents of the Eastern region, who's hosting this fourth and final webinar of the year, right? And there will be more. You're going to be seeing more programs, not only at the national or regional level, but also at the local chapters. And we're very excited to have you. And again, thank you for being with us.
Thank you, Dr. Remigio. And to give us her welcome and opening and key points, our president, Dr. Gloria Briones.
So good evening, everyone, and welcome to all my colleagues across the country that are eager to learn about Alzheimer's and all forms of dementia, and to support the Alzheimer's Association to fight Alzheimer's and other forms of dementia, to eradicate it, if you will, through our advocacy. So tonight, we are going to learn more, and thank you to our speakers who are here tonight to enlighten us and to give us more hope and what is ahead of us for this disease that we wanted to stop. And again, on behalf of the Executive Board of the PNA of America, we are here to advocate, to eradicate the Alzheimer's and other forms of dementia. So thank you, everyone. And we will continue to listen to the speakers that will hear tonight. they are here, Miss Eddie Yao, and I think we have another speaker. That's Dr. Yon. Is it the way to pronounce?
Cute.
Okay, thank you.
Okay, thank you, Dr. Briones. And to start off with our first speaker that will guide us with this very insightful journey to bring his wealth of experience and knowledge to shed light on practical strategies for navigating the challenges presented by dementia-related behaviors. We have Mr. Jun He, is a program manager at the Alzheimer's Association New York City chapter, where he helps to connect Alzheimer's and dementia resources to various communities across NYC with specific focus on Manhattan and Upper Queens. So these resources, including conducting education programs, providing care consultations to those who are seeking answers to dementia, Alzheimer's related questions, and referrals, which is really important in terms of dementia care. So take it away, June. Welcome to PNAA.
Great. Thank you so much. Thank you so much for having me, and thank you so much for the wonderful introduction. Again, my name is June. I'm the program manager at the New York City chapter of the Alzheimer's Association. Again, I do a lot of the education programs, all that good stuff. And today, while I get this set up, I'm going to be talking a lot about understanding and responding to dementia-related behaviors. So here we go. Ooh, once I get that shared, and there we go. Alrighty. Let me go ahead and do that. So really, from today's program, right? So by the end of today's program, you will be able to, one, right, identify common triggers for behaviors associated with dementia, right? Two, we're also going to explain the process for assessing and identifying those challenging behaviors, because as we know, right, with Alzheimer's disease and other dementias, right, it is a very challenging disease, right? And there's so many different symptoms that come up, so many different new behaviors that might arise too. Right, so we really are going to talk a lot about that. We're also going to talk about strategies, right, to address those really common dementia-related behaviors too. So lots to talk about today. So really, when we talk about some triggers, right, so some of the most difficult behaviors that we see for caregivers, right, to understand and arise, right, it's usually within the middle stage of the disease, right? And as we know, with the disease, there's the early, middle, and the late stages. Right, so with some of these behavioral symptoms, right, it can also be caused by sometimes maybe the physical discomfort, right? Sometimes pain or discomfort that could come from maybe fatigue, hunger, right? Maybe they're thirsty, right? Maybe there's constipation, full bladder, UTI, or maybe there's an uncomfortable room temperature, right? These are all different things that could really cause some of these triggers for these new behaviors. Right, there could also be sometimes maybe triggered by the overstimulation, right, boredom, sadness, loss, right, being isolated too, right, even just us who may not have Alzheimer's dementia, right, also isolation, that really plays a big part, right. Of course, you know, sometimes when we are finding these different behavior changes, right, sometimes those causes, it might be hard to sort out, but it's also really helpful that we do take the steps, right, to really understand and address the behaviors. And that's what we're going to be talking a lot about today, right? So on the next few slides, we're going to really present that outline of those steps, right, that we're going to take, and then we're going to apply those steps to some of those most challenging behaviors that we do see that many caregivers, and maybe also many of the medical professionals, might also commonly face too. So when we are talking about understanding and addressing the behavior, right, we're going to really use this 4-step process a lot today, right? So number 1, detecting and connecting, right? Number 2, addressing the physical needs first. Number 3, then we're going to address the emotional needs. And number 4, reassess and plan for the next time. So we're going to go ahead and take a bit of a deep dive into each of the steps. Right, so first one, right, step number 1 is detecting and connecting, right? How are we going to detect and connect? We're going to join that person's reality, right? So that means really seeing the world through their eyes rather than your own, right? So when we remember that, behavior is a form of communication, right? We know that if we could see the world through the eyes of the person with dementia, and if we experience what they experience in the way that they do, right, then that behavior just makes so much sense, right? And of course, since the person, they are the ones with the disease, right? We can't expect them to accommodate our needs, right? Instead, we must try to also enter their world, right? Connect with them as they are, right? And we want to do our best to really do our detective work, right? And to really just decode what they're expressing. Now, of course, sometimes, we can't just simply figure it out, like, where is this behavior even coming from, right? Or what the person's trying to communicate through that behavior. However, though, it is our job to make sure that we do try to make every attempt possible in order for us to understand the behaviors before we intervene so we know how to help, right? So sometimes we might ask ourselves the who, what, when, where, and how, right? So who was there when it took place, right? Maybe we ask what happened right before the behavior even began, right? Maybe what were you doing? What were someone else doing? What were they doing, right? Maybe what happened after that behavior might have taken place, right? We want to think where does this behavior usually take place, right? Maybe what was the person seeing, hearing, or touching, right? When, right? We also want to think, when does this behavior occur? Does it keep occurring during nighttime? Maybe it happens right after they wake up, or right after or before breakfast or lunch, right? We want to think, is there a particular time of day that this keeps happening, right? The how is also, we really want to think, how did we react, right? So we also want to connect with the person as we also assess the situation, right? So we're always going to approach the person calmly and respectfully, and of course, treat them as, you would want to be treated in that same situation. Of course, whenever we are detecting connecting and we are connecting with a person with Alzheimer's dementia, we're always going to begin by coming to the person from the front, right? We don't want to approach them from the back because that might also elicit some aggressive behaviors. They might get upset, they might get shocked, surprised if we surprise them from the back, right? So we always want to approach them from the front, and then also want to identify yourself if necessary, right? So we always want to move to their physical level, use eye contact, and our good friendly body language to make sure that we have that friendly approach too, right? And this person, they're gonna probably respond more to your tone and your body language rather than the actual words, right? So it's really important that we do try to be as kind and helpful as possible, both with the language and also your emotional state too. So next, right, addressing the person's needs with the physical, right? So always want to begin by exploring any needs that might be physical pain, right? Or maybe even a medical condition, right? So we always want to think, what kind of medications? Is there a prior illness to this person, prior medical condition that's already there, right? We want to note any signs of injury, right? Maybe there was a recent fall that they had, right? We will always want to ask those questions or come up with those concerns too, right? Also, people with Alzheimer's disease, they do often actually experience pain from an undiagnosed UTI, right? An urinary tract infection. Sometimes they might also experience, compression fractures, arthritis. Maybe their dentures are very poorly fitted, right? There's indigestion, constipation, or maybe other medical conditions too, right? So we always want to explore all that, right? Also, right, there could be a reaction to new medication too. So maybe also keeping that in mind when we are talking about addressing those physical needs too. So we always want to know any unusual behaviors or symptoms and also report them as promptly as possible so that we are able to rule out any of those medical causes of that person's pain too. Right? And of course, there could be also environmental issues too, right? Sometimes their clothing just too tight on them, right? Maybe there's lighting that's really bothering them. Maybe the sunlight's in their eyes, right? Or maybe it's just too cold or too hot, right? We want to explore all those physical, environmental triggers too. And then number 3, we want to address those emotional needs, right? We are all humans. We all feel things. That is also the same for a person with Alzheimer's or dementia, right? So we always want to think how the situation feels to this person, right? That's usually that basis for this person's behavioral reactions too, right? And then we're going to focus on those feelings in your response instead of on the facts of the situation, right? We always want to also avoid correcting the person, right? If what they say might be inaccurate, right? Remember, we're trying to connect with them from where they are, right? We want to join the person's reality. So only just telling them like, oh no, you're wrong, that might actually just only escalate the situation and just really convey that, you don't understand them, right? So it might just get even harder for them to convince you, and then they might get upset, right? Let the person know that, that you are with them, right? And that you are safe together with them. And also reinforce that you are there to help, right? We also want to address the emotion behind the behavior too, right? To help make the person feel a lot less overwhelmed and alone too, right? Many times we do see that because they feel alone, they feel like they're misunderstood, then we kind of see some of these problems also rising too. And then also finally, we want to help the person also redirect the energy into more soothing activity, right? Something that's more enjoyable for them too. Now, of course, the final step is we want to always ask ourselves, right? Did this work? Did this new response work or did it not? Right? So we want to reassess and plan for the next time, right? Again, going back to detecting and connecting, joining the person's reality, right? Now, how does the situation look now to that person with dementia, right? Do we need to explore other potential causes? Maybe we need to explore other methods, right? Maybe it might be that you need another person to actually talk to this person, right? So we want to think, what can you do differently? What went well, what didn't, and how can you make adjustments? Great. So, with these 4 steps, right, these probably can be also applied to any behavior, right, really experienced by someone with dementia. So now in the upcoming slides, we're going to go ahead and take a look, right, on how we can use these steps and apply that to some of the most common dementia-related behaviors too. So number 1, right, and this is probably the one that we know the most, right, confusion or suspicion, right? So when someone with Alzheimer's disease is confused, right, they might not recognize the familiar people, right, places or things. And of course, when that confusion is also paired with suspicion, now that person might accuse others of maybe stealing, right, being unfaithful, etc. Right, so it could be very difficult, right, especially when the person can't remember who that person is, or that they're asking the same questions over and over again. Right, so now this is my fun part. I have an example with a woman named Anne, who's a woman living with Alzheimer's disease, right? So we're going to use this example with Anne, and then we're going to try using those 4 steps together, right? So here's our example. Number 1, right? When Anne's family comes to visit and the evening time begins, she becomes very suspicious that people are trying to get into her house and are watching her through the big picture windows, right? She becomes very suspicious of her family for not making the people go away, and that they all must be in cahoots with each other, right? So, big example with Anne happens quite often, actually, right? So, we're going to take the steps, right? We're going to keep Anne's situation in mind as we review these steps. So, number 1, right? Detecting and connecting. We want to stay calm, right, as we explore. We're going to do some detective work, right? So what is that confused or suspicious behavior, right? We're going to talk about the when, who, what, when, where, and how, right? When is it happening, with who, where, and how does it manifest, right? So in this situation, we know that Anne is very suspicious during the evening times with the windows, right? So we want to check the environment for any, sources of confusion, right? So in Anne's situation, for example, it might be that Anne's actually seeing people outside for their nightly jog, right? Maybe outside in the neighborhood, and that those are actually the people that are trying to get into her house, right? So we want to also discern whether the person is reacting to something in the present or maybe something that's imagined or in the past too, right? So if the trigger is current, right, we also want to explore how the person is interpreting that occurrence, right? So for example, if the person misplaced something, right, they might worry that someone stole it, right? But if the trigger is something that's imagined or in the past, right, maybe we can try to do our detective work, right? See and try to understand what that situation actually meant to the person, right? Sometimes we might need to offer some corrections, but as gentle suggestions or answers, right? If we escalate our energy level, person's going to match it, and it's going to increase even further, right? So we always want to be careful with that. Something that might also help too, right? Showing photos and other reminders, right? Written reminders too. That could also really help, especially when we are trying to, address the physical needs and also address the emotional needs too, right? Again, we want to remind ourselves that it's not about diffusing the situation. It's about diffusing the situation, not convincing the person of the truth, right? And of course, might need to also address the physical needs by modifying the environment if needed, right? So in Anne's situation, maybe Anne was actually seeing, the family's reflection in the window, right? Maybe we can then close all the curtains during nighttime, right? Maybe if it was a mirror, right, that she's actually talking about, maybe we take down the mirrors, right, or flip it away during the nighttime, right? Or if it was a TV, right? She's watching TV and she's thinking that people are actually coming in because of the TV. Maybe we turn off that TV at night, right? All these are examples of just kind of modifying the environment. And of course, we always want to respond with a very brief and accurate explanation, right? So we want to keep it short and simple. If we take it too long, we might lose them, and we have to keep explaining over and over, right? So we'll always keep it short and simple. Always my good tip. With the also physical issues too, we want to rule out any medical explanations, right? Maybe it could be an infection, maybe there is low blood sugar levels, or maybe there's delirium, right? Or again, the physical discomfort, maybe because of the environment or overstimulation, maybe even fatigue too, right? And of course, with the emotional needs, we always want to let the person know that you do understand, right? Let the person know that, yes, I will take care of the situation. I'm here to help you, right? Again, we're going to join the person's reality, let them know that you are there to help and that you are on their side, right? So even just saying something like, I'm so sorry that this is happening, and, let's see what we can do to fix it together, right? And of course, try not to take the person's confusion or behavior personally, right? Again, sometimes it's the disease talking, right? Not a true reflection of who they are as a person. And lastly, reassess and plan for the next time. So we always want to think, did this work? Did this not? Do we need other causes? Do we need other solutions, etc.? And we always, always, always want to assume that the person will feel confused or suspicious again, right? We always want to make a plan for that in the future. Great. So our next behavior is aggression, right? So sometimes aggressive behavior, it might be verbal, it might be physical, right? It might occur suddenly for no apparent reason, or maybe it might even follow a certain trigger, right? So we're going to come back to Anne, and now we got a new character. His name is Bill, and Bill is Anne's husband. All right, so here's our next example, number 2. So Anne's husband, Bill, is standing at the back of the room, leaning against the wall with his arms crossed, watching television. So Anne walks in and tells him sharply, "You aren't the boss here." Bill ignores the comments and continues to watch television. So Anne comes closer, raises her voice, and says, "You can't tell me what to do." When Bill doesn't respond, Anne comes up to Bill and hits him on the arm with a balled fist. Prior to her dementia symptoms, Anne was very calm by nature and would never have exhibited this behavior. Lately, though, her outbursts are becoming more frequent she continues to come at Bill, who retreats from her and locks himself into the bathroom to avoid further conflict. And he does not have a cell phone with him. Okay. Oh, Bill, what are we going to do with Bill? So we're going to take the 4 steps, right? We're not going to be like Bill. We're not going to ignore her. We're going to take these 4 steps. We're going to detect and connect, right? So number 1, we want to try to identify what is the immediate trigger for that aggression, right? Did something frighten them? Maybe something alarm them, right? Maybe it might be an automatic reaction to something, right? So maybe in this situation, right, maybe it was Bill's body language, right, with him crossing his arms, right, and standing up, or maybe something that was said on TV, right? Maybe there's something that was on TV might have said something aggressive, right? So again, we always want to ask ourselves the who, what, when, where, and how questions. We're going to explore that situation, right? Again, gently say the person's name, let them know that you do understand and you're here to help, right? Before we try to intervene, right? Of course, sometimes we might need to apologize when it, seems that it would help calm the person, right? So you might be apologizing for something that probably didn't even do, right? But again, this apology is a reflection of the person's reality, not yours, right? So maybe even saying something like, I'm sorry, I made you feel that way. What would you like for me to do to make you feel better? And again, we're going to screen for the environment for any, obvious triggers, excess noise, etc., and make those adjustments. Of course, with the physical needs, again, we want to rule out any medical causes, right? Some people, they do start lashing out with aggression when they are in pain, right? So we want to also make sure that we think what could have caused this pain, right? Limit or remove any distractions, and we always want to be sure that if the aggression does become very big, we want to protect everyone involved so that no one gets hurt, right? So maybe sometimes we might need to ask the children to leave the room for a little bit, or maybe we might need some additional people to provide that assistance, right? Again, part of your role is also to make sure that everyone is safe. And in step 3, we're going to address those emotional needs, so screening for those emotional triggers, right? Sometimes people, they might act aggressively when they see that there is danger, when they might think that there is danger, or when they're scared, right? Surprised, maybe they're in pain, etc., right? It might not be directly related to you too, right? Again, we're going to focus on the facts. We're going to focus on the feelings, not the facts. Ooh, almost made a mistake. And we always want to be positive and reassuring, right? Let the person know that you are there for them, right? And that you're here to help work out the situation together, right? And again, reassessing and planning for the next time. As always, we're going to make sure that we recognize that, again, this aggression might come up again in the future, right? So we're always going to plan that, yes, this is going to come up again. And yes, we're going to have a plan B, and make sure that we know what's the best way to diffuse this person's aggression, right? So even also alerting, neighbors, alerting family members, right? Alerting others around you, that could also be another way that we kind of plan for the next time, right? Making sure that we do have those positive relationships with those who are able to help with, the situation, maybe even getting like a personal security alarm or something, right? Again, planning for the next time. Great. So our next one, this is very common, right, amongst those with dementia, and it also could get very frustrating, right? Repetition, right? So saying something over and over again, repeating words, questions, or even behaviors too, right? But of course, we always want to avoid correcting in this situation. And we always want to remember, again, the person, you probably can't remember that they just asked the same question like 5 minutes ago, right? So here we go. We're going to go back to Anne, and we're going to have a quick example about repetition. So here's our number 3. Anne has recently been concerned about an upcoming visit from her daughter. So though her daughter, Katie, is not scheduled to visit for another 2 weeks, Anne has begun to repeatedly ask her husband, Bill, when is Katie going to arrive? Anne asks several times throughout the day, every day, which has begun to wear on Bill. So Bill starts finding himself answering impatiently or even ignoring Anne's questions. At the same time, Anne is going to the bathroom much more frequently than she ever has before, every 10 to 20 minutes. Okay, so again, we're going to keep Anne's situation in mind as we review these steps. 1, detecting and connecting. Stay calm, be patient, the who, what, when, where, and how, and we're going to look for those triggers and patterns, right? All the same stuff that we've probably been talking about before, right? Again, with repetition, though, we do want to accept the behavior rather than fighting to stop it, right? So you're going to need to work with that behavior rather than against it, right? In order for us to intervene successfully, right? So we may need to answer Anne's question repeatedly or write things down for Anne so that the frequency of how many times she asks a question, that could potentially lessen, right? And again, we don't want to do what Bill just did. We don't want to completely ignore them. Right? And step 2, of course, addressing physical issues first. As always, we're going to look for pain, right? Maybe explore whether the person is experiencing pain, and of course, making sure that we make the adjustments. So in Anne's situation, we saw that she's going to the bathroom a lot more frequently, 10 to 20 minutes. That could be a sign for UTI, right? A urinary tract infection. So we always want to make sure that we keep those in check too, right? Physical environment for triggers, as always, and also, calling on different medical professionals to assist if the behavior change takes place very suddenly, right? So again, right, the behaviors that you might see, it might be a result of an infection, UTI, or maybe it could be a medical issue or a medication side effect, right? Of course, we want to address the emotional needs, again, right? Saying something that recognizes that emotional state to help you move on to the next step in your intervention. That's going to help a lot, right? Keeping in mind the emotion behind the behavior that might be fueling the repetition, right? So addressing the emotional need might also help diminish that repeated questions. And we want to always briefly answer the person's questions or even address the concerns. Right? Making use of memory aids, again, like notes, photos, calendars, right? We want to try using that because sometimes they just need that written reminders, right? And more times than not, we do see that actually does help with the repetition too, right? And again, we want to remember that the repetition is a part of the disease, right? So engaging the person in a purposeful activity to redirect their focus to, right? That can also be a very good tip, especially when we are seeing a lot of repetition, right? So turning that action or behavior being displayed into an activity with a positive focus, right? Kind of like a repetitive activity, right? Like maybe even wiping countertops, right? Folding towels over and over again, or, sorting laundry by color, doing puzzles over and over again, right? That could also help too, right? They just need to let that repetition out with an activity, right? And of course, step 4, reassessing and planning for the next time, right? So finally, we're gonna always ask ourselves whether, this new response helped, what can we do differently the next time if it didn't work? And of course, remember that this is a symptom, right, that comes with the disease progressing, right? So just try to do what you can to kind of maintain that emotional distance from the behavior, right? Don't try not to take it too personally, right? Again, sometimes it's disease talking rather than the actual true reflection of them. So, want to keep that in mind. And of course, as always, we want to expect that this is going to happen again. We're going to need a plan B, maybe even plan C. We're going to always be prepared. Great. And of course, we also have wandering too. So 60% of people with dementia will wander, and it can also happen at any stage without warning, right? So with this one now, we see that Anne and Bill actually spent the early years of their marriage in New Jersey, and they actually moved out of the state to their current home 30 years ago, right? So Anne actually constantly asks over and over again to visit New Jersey, and she says she's going to New Jersey, but she's been found by neighbors on many occasions at their church, on neighborhood streets, and one time also at a very busy intersection near their home. And their daughter, Katie, is very worried about potential injury. Bill is also worried and is at loss of what to do. Bill is logical and tries to explain to Anne why they can't visit New Jersey, although he recognizes that this approach is not working. All right, so Anne is trying to wander to New Jersey, right, even though she doesn't live in New Jersey. So again, here we go. Number one, detecting, connecting. Again, broken record, but this is really important, right? The who, what, when, where, and hows, right? What are some possible triggers, right? Maybe she saw a picture, and now she's really adamant about going back to New Jersey because she saw the picture of New Jersey, right? Want to join the person's reality and try to accept, anything that the person says about their wandering, right? Being goal directed. And of course, the physical issues, pain, sometimes wandering also begins, right, in that attempt to move away from the pain, right? And of course, if that change is sudden, we're going to consult with the person's doctor for an assessment, right? Maybe there is also some environmental triggers, right? Some difficulty adjusting to a new place or with their immediate surroundings, right? Maybe there's a change in medication, maybe there's a change in patterns of exercise, scheduling, etc. Maybe there's an unmet need, right? Maybe there's hunger or thirst or even going to the bathroom, right? They're trying to get away from something that's unpleasant, right? Which could also cause that wandering too, right? And then again, we're going to address the emotional needs. So maybe we're thinking this person's just really bored or very understimulated, right? Maybe naming the feelings, letting the person know, hey, you look very sad, you look very bored. What should we do together, right? What can I do to help you with this, right? Providing the reassurance that you are there to help you. And of course, reassessing and planning for next time. So if possible, really help the person do what they want, right? Maybe they just want to walk in the park. Maybe they just want to walk down back and forth in the hallways. If not possible to do that at the moment, maybe agree and then delay. So what I mean by agree and delay is, for example, right? You can say, yeah, sure, maybe a walk is great, but it's almost lunchtime. Is it okay if we do it after lunch, right? So we always want to think about that and making changes to a person's surroundings if necessary too. Great. All right. So before we get into any questions, we do have our 24/7 helpline, which is a great resource at the Alzheimer's Association. It is free and no cost to use too. We have master level clinicians, social workers, care consultants, 24/7 to really help with any questions they might have with any Alzheimer's or dementia-related, questions or action plans too. So definitely take this number down. I think it's really important. And of course, our website's alz.org, so you can learn more about that. And again, before we go into questions, I believe it's Edie next who will be speaking about the Alzheimer's Association. So thank you so much for listening to my part, and here we go.
Thank you, June. So Edie is probably not someone new to you. If you attended the Western Region Conference, she delivered an excellent keynote. And also, if you attended other events or other webinars, so Edie is our permanent person, which is our great connection with Alzheimer's Association. So she's the Director of Diversity, Equity, and Inclusion Engagement for the Alzheimer's Association, and she leads strategic initiatives to reach underserved communities in the pursuit of health equity, which is the mantra of our president as well. She leads national partnerships to increase access to resources and support for all those affected by Alzheimer's. and all other dementia. So she collaborates with partners to spearhead initiatives that are culturally tailored, just like us Filipino Americans, ensuring communities to have access to Alzheimer's and dementia education and resources to reduce the racial and ethnic disparities in dementia care. As a result of her leadership, the association has broadened its reach in Asian American communities, same as this partnership with PNAA and Alzheimer's Association. So Edie, you have the floor as always. We always welcome you. Always a
Thank
pleasure having you.
Well, thank you, Dr. Ramos. And it's always so good to see all of you and just have enjoyed our time together. And thank you, June, for your presentation. I think the examples are helpful, right? So even when we think we know how to deal with repetition or aggravation, it's helpful to walk through those steps. So thank you so much. And I hope you all found it helpful. I think I just want to take this time to kind of reflect on what we've done so far. Just been delighted to work with Philippine Nurses Association of America. And, again, I always think back to nurses are the most trusted profession. The most trusted profession. That's a very impressive thing to be known for. And it is so true. And so we have been partnering with all of you, knowing that it's so important for us to get the word out, to really convey how important it is to get the latest information out. And we want to make sure that you as nurses have the latest information about Alzheimer's. In the last 3 years, we've seen such progress in research. There have been 3 or 4 different new therapies that have been FDA approved, one for insomnia, one for anxiety, 2 that actually address the underlying biology of Alzheimer's. And those are important and only effective if you are detected early. And so we really need to get out to our communities and help people understand why early detection is so important, why diagnosis is so important, because we can actually do something about it now. And even if those treatments are not readily available now, we know that there are over 130 new therapies that are in the pipeline that are looking to hopefully get FDA approval at some point. So our work is certainly about creating a world without Alzheimer's, and that means everyone is in the fold, right? And so as Mary Joyce had said, my work in diversity, equity, inclusion is very much about ensuring that we are including populations that have been underrepresented and underserved, and certainly Asian Americans are underrepresented in research. In fact, less than 3% of Asian Americans are represented in Alzheimer's disease and dementia research. And it's so important that researchers understand how these therapies work for all populations. So, I really salute Dr. Ramos for her study that she's doing on Filipino caregivers, funded by the Alzheimer's Association, one of the members of the first cohort of the Alzheimer's Association Summer Institute. We need more people to study how Alzheimer's and dementia impacts Asian Americans. And we also need more people to help be a part of the cause and to help educate communities about what's available and reduce the stigma around this, if you will. So I think you all know a lot about what the Alzheimer's Association does. I will put in the chat the link to our diversity, equity, and inclusion work, and June did a beautiful job of sharing our helpline, which is such an important resource, and our website. And I just want to, think about this webinar series that this is the last one of the series, but not the last piece of our work together. But we started with the basics of understanding Alzheimer's, led by Western region, and then South Central covered dementia conversations. How do you actually have that conversation? And then North Central region covered cognitive screening, healthy living for your brain and body. That was with Dr. Nicole Purcell. And today, how do you respond to dementia behaviors? So where do we go from here? I think it really is around activation in communities. I know that Philippine Nurses Association, there are at least 50 chapters across the country. The Alzheimer's Association has 75 chapters across the country. Are there ways that we can combine our efforts to help educate communities? And I'm going to look forward to conversations with the leadership here at PNAA to talk more about what that would look like. But I invite you to continue to join us in education and awareness, and to advocate also for more representation of Asian Americans, including Filipino Americans, because we know that there's such diversity of our Asian population. And we have to understand that there are so many different cultures within Asian Americans. If you've not seen, the Pew Research Center recently had, I guess, an article on the Asian American cultures in America. And that's led by a new leader at the Pew Research, a Filipino American, Neil Ruiz, who's really leading the charge to make sure that we are not invisible as the fastest growing racial ethnic group. I think we are going to see more and more dementia in families, and our job is to make sure that people have the best care possible, whether it's at home or in long-term care communities. We know that this is a challenge for people. So early detection, diagnosis, the best care possible for people with dementia, and representation in research so that we are also included in this whole process. That's the general thinking that I have, and on behalf of the Alzheimer's Association, really want to thank Philippine Nurses Association for your partnership and your leadership. I want to thank Mary Joyce Ramos for her just tremendous leadership in the webinar series, Dr. Barriones for your leadership and having the pleasure of meeting you multiple times in person, and Dr. Gerardo as well for your leadership. So let me make sure to leave some time for Q&A. So I'll turn it back to you.
Yep, so I'm calling Angelo Bosque. He's our communications and marketing co-chair. So he'll be leading Q&A. And I'm not sure, Angelo, do you have like specific question that you want to start off or just some in the chat box to our speakers?
Yes, good evening. I'm just a member, by the way. We have one question from Joy Aureliano. Is there a difference between the management of Alzheimer's dementia versus Parkinson's disease dementia?
Should I take that one, PD?
Alzheimer's disease dementia.
I mean,
and
I can probably slightly answer that because it was tackled last session in webinar series 3, because there are different types of Alzheimer's. So I mean dementia. So Alzheimer's is the most common type, and when you're talking about Alzheimer's, so mainly it's the accumulation of beta amyloid plaques and tau tangles in the brain. So it can lead to, neurodegeneration primarily in areas associated with memory and cognition. While for Parkinson's disease dementia, it develops mainly as a result of the same neurodegeneration, but it's associated with Parkinson's disease where Lewy bodies, which is another type, where there is abnormal protein aggregates, affect various brain regions, including those involved in motor control and cognitive function. So when you're talking about managing it, let me start with probably with pharmacological perspective. I know June mentioned about the behavioral, because most of those behavioral symptoms are the same. They're similar. So whatever behavioral symptoms are, you manage it almost similar in terms of that approach. That's why June have it repetitively. But when you're talking about treatment approaches, so since they have different pathological cause, so for Alzheimer's, you normally give cholinesterase inhibitors. Mostly people know, especially for our nurses, donepezil is common. But just like what Edie mentioned, there's like new 2 drugs approved by FDA. So memantine is also common for managing cognitive symptoms, while for PDD, there's no specific medication for that, but they normally use especially for Parkinson's, levodopa, dopamine agonists, and some drugs to address those movement issues rather than the actual cholinesterase inhibitors. So it's just I guess I answered it in a pharmacological perspective because we discussed it last time, and I thought like, oh, well, let's, bring it up because we have like different audience this time as well because it's Eastern region, and most attendees last time were from North Central.
Thank you so much, Dr. Ramos. Do you have any follow-up question, Ms. Aureliano?
Hi, thank you for addressing that. I'm just wondering about the management that June had really very much kind of put out there on the screen, the 4 steps, because most of the Parkinson's disease dementia patients, they usually have really delusions. I wonder if Alzheimer's disease has that too, because I'm not familiar with Alzheimer's disease dementia. So that's my basic thing, especially with taking care of them at home or the nursing management if they're in the skilled nursing facility. Thank you.
Oh, I'm sorry. I thought like June will respond, but I was like, yeah, I mean, the delusions are not normally part of the behavioral, because delusions are mostly cognitive and psych, compared to the behavior that you can actually see. That's why the approach is basically physical at first. So when you're talking about those delusions, like as nurses, we prioritize on safety of the patient. So we usually put that first in mind. And then second, it's like, concept of reality in there will not be mostly checked because, they're already delusional. So that's thing. Dr. Tess Medina, which is our psych mental health person, will probably have different perspective on, sorry, Dr. Medina, I don't want to put you in there, but you're the psych person in here, which is to manage that specific behavior. So
you see, delusions are fixed belief and we don't ever challenge them. There's no putting them back in reality. You will just agitate the patient more if you confront the delusions with the progressive decline in cognitive function. And particularly, I have a lot of patients with dementia and comorbid with depression, or if they have, a pre-dementia problem with schizophrenia or bipolar disorder. Those are very, very difficult to treat. And those are my patients that I have, particularly at 6 p.m. It is a very, very interesting place to be when where all my Jerrys are. And then coupled with some of my involuntary patients, it's you have to be a saint to work in that space. It's very hard. But thank you, June, for your presentation. It just really reiterated, what we do and how we manage them. And it's very, very hard for caregivers, particularly, because it's almost like a thankless job. Your mom acting like, a 12-year-old not recognizing you. And what is sad in my experience with this population is caregivers give up on them and they just leave them in the hospital. And for us to take care of them, I have patients that I have 100 days, family don't want them, and with terminal illness on top of, I have one that had a brain cancer. And family refused to take him, and he eventually died in the hospital. So I have those type of, caregiver burden, that there are many challenges in this, with this population. But delusions, there's no meds for it. There's no meds for it. Unfortunately, with all the pharmacological, products there's really no fixing, curing, or stopping the progression of this dreadful illness. Right. Thank you.
Thank you, Dr. Medina. I'm sorry to putting you in spotlight.
All right.
But I always appreciate your being dynamic and flexible. And it's almost like 10, it's already 10 p.m. I'm sorry, we cannot entertain more questions, but June shared the phone number, and it's actually 24 hours, and you can just call and ask those questions. I tried it multiple times, just asking weird questions, and they actually answer. So, which is I don't know, yeah, because if it's really helpful, before I recommend something, I would like to test it myself. And I was able to do that when I have some questions, especially with regards to managing caregivers. So before we end and have Dr. Jurado close our session for tonight, we would like to thank the PNA Foundation for providing one contact hour for tonight. Mr. Pete Calixto, who is always policing us. I'm just kidding. Checking, making sure that we are in line with our objectives for the day, and to provide that contact hour. So Carol will be showing the QR code. There it is. And if you need the link, we'll also post it so you can finish your evaluation. And once you're done with it, it will automatically send you the contact hours from PNAF. So, yep.
Mary Joyce, there was a question in there. Are the previous webinars available for people to view?
Yeah, actually Carol recorded that one. So we were actually, because we didn't ask the speakers if it's all right for it to be shared, live, but if it's okay, for everybody, June, we'll post it in our social media, and then we can also send it to the participants' emails.
Great.
Yeah, so while you're doing probably the contact hours, let me call on Dr. Dio Jurado to close us for the year. This is our fourth, and I would like to recognize Mr. Bob Gahol from Western Region, our Vice President, and of course, Mr. Manny Ramos from South Central Region, who did an amazing job to link some of our members, especially our leaders, with Alzheimer's associations, chapters or groups. So let me use Dr. Jurado.
Okay. Good evening, everyone. Wow, what a way to end our partnership with Alzheimer's Association, and truly a profound partnership that has been forged by our expert here, Dr. Mary Joyce Ramos and Edie Yao. Edie, we thank you for connecting with us and for being persistent. And, you know, these webinars truly have increased our knowledge, our skills, and attitude, even so that our values as Filipinos is pretty much very respectful to elderly. Uh, these webinars have helped us maneuver our ways to care for patients with Alzheimer's. I mean, even just today, I thought that I could easily remember what June talked about in terms of the 4 steps. That is detect and reconnect. The second is address the physical symptoms. The third is address the emotional symptoms or emotional distress. And the last one would be to reassess and plan for the next time. So, I mean, even just that very basic information that we can arm ourselves, it's time we care for these patients, not only at the hospitals, but we have dealt or we will be dealing with this type of condition, which is truly, I would say, very crippling mentally and debilitating physically. We hope that we can continue working together. You know, yes, we're ending the year-long partnership, but I think we just broached this continuing partnership with Alzheimer's because we now have started it. And Edie, you've been a champion for bringing Alzheimer's to our midst within Asian American, particularly Filipino Americans, and particularly nurses. I think this is a really great partnership between Philippine Nurses Association that provided the platform where these webinars can be presented, and obviously our membership have benefited from it. So thank you very much, and yeah, let's look forward to maybe a second round of this. And thank you for the participants. And again, I really would like to thank Mary Joyce for her expertise and for her research work. And I don't know any other Filipino American educators or researchers who are working on this area. So kudos to you, Mary Joyce. Keep up the great work. And this would be your legacy as a leader. And thank you, Dr. Briones, for working with your VPs in ensuring that we were able to hold this in every region of PNA America. So good night, everyone, and see you next time.
Thanks, everyone. And again, thank you to Dr. Warley Remigio for putting this together for Eastern region. So we appreciate like how he have all of the members, especially like, from different chapters of the Eastern region, very well represented. So thank you, everyone.
Mary Joyce,
Mhm.
I know you requested a raffle.
Yes, can we do
Yes.
Yeah, because
Just
this is our last, and we have like 5 people who can get a $50 gift card. Thank you for attending our last session. So we're giving away $50 gift card that you can use for, I don't know, holidays, gift giving.
so just bear with. Yeah, so just bear with me because I had to type this really quick, So I only have first initial and last name, but I was able to get almost everyone in here. Of course, the planners I didn't include. So okay. So the first one, Dolores Cook.
Nice.
Is she here, Dolores? You have to be present to win.
Yeah, and please please send us a message of your email to send the gift card. Because you might have like a different email that, that you register for the webinar. So if you can send like where you want to receive the gift card for the email.
Okay, I don't hear Dolores. We might have to draw another one. Let's see. Next. So
Dolores
lucky
was
for those-
actually here.
Dolores is here.
Yeah.
Great, Portia. Congrats, Greeley.
Greeley was here. She's the president of PNA Maryland.
She's no longer here.
No, she's here.
Oh, okay. All right. Say hi, Greeley. Next. Oh my.
He'll donate it.
Pete Calixto. Pete does not need this.
Okay. He can give it to someone in San Francisco.
Well, you can draw another name.
Oh, that's so nice of Pete. Thank you.
I have my own Starbucks here at home.
Thanks, Pete.
Christine Zamora.
Ooh, Christine.
Christine, are you here?
Yes, I am.
Oh, congratulations.
Very nice.
Yay.
Okay.
3 more.
3 more? Are you sure?
Si Dolores po.
Hi, Joy Arellano. Congrats, Joy.
Yay, thank you.
Congrats, Sita Joy.
That's what you
Yeah,
get for
thank
asking
you.
a question, Ate Joy.
Oh, thank you.
All right.
Thank you so much.
Okay. Is this the last one, Mary Joyce?
Yeah, last one.
Okay. Ian
Oh.
Spirit.
Oh, he won
Leading
again. I
them.
remember him winning before.
Wow.
Ian,
Maswerte
congratulations.
si Ian.
Congratulations to all the winners.
Yep. So thank you,
There's-
everyone.
There's Dolores Cook.
Yeah.
Yeah, she's
Mary
present.
Joyce, let's have a picture. Let's take
Oh,
a
yeah,
picture.
yeah.
Ian, meron na tayong pangkape.
Okay.
Let's ask